Hi, I'm Tracy Marciniak. I am the president of the Miller-Dwan Foundation.
I'm Rick Gertzma. I'm the Senior Mental Health Advisor with the Miller-Dwan Foundation.
HopeX is the Miller-Dwan Foundation's initiative to solve the mental health crisis in our region. HopeX really came about as a direction from our board of directors, recognizing that really there was a behavioral health crisis prior to the pandemic. And once the pandemic set in, it exacerbated completely. Everyone was impacted in some way, shape, or form. And we really have a mission as Miller-Dwan Foundation to provide the healthiest region possible for the people who live here.
When I started at the foundation, Tracy Marciniak, the president of the foundation, asked that I take a look at what is happening globally in response to the pandemic, nationally and locally. Tracy's vision was we needed to start making a difference in the community and doing more outreach. We know that there's a crisis. We know that we have the passion. We know that we have the drive, and we have the desire to really help and make a difference in people's lives.
HopeX is our multi-phase approach to resolving the crisis. And the first phase of HopeX is to really grow the behavioral health workforce. We know that there are a lot of people in the region who have mild to moderate depression or anxiety, and they are not necessarily seeking or want to seek out the help of an inpatient unit or a therapist, and they're frankly not at that level of need where they would need that type of care. Our Problem Management Plus program that we are launching is really designed to work upstream and serve people who are experiencing stress and anxiety and actually can recover quite well with some solid skills and some education.
What we've done is identified community-based organizations, we say CBOs. From those CBOs, there will be 2 people, and then we will train those people who are already working within those organizations, and then they will work with at least 5 people in delivering PM+. So they're already embedded in their community, they're already trusted in their community, it's already somebody who's known to them. In an ideal world, it would be a possibility to be able to visit with your primary care doctor or your primary care provider, and they would be aware enough of saying, you know, there's this thing called PM+ that's in our community, and I think it may be of help to you. Before we get to the point of therapy, before we get to the point of those major interventions.
Phase 2 is also looking at how do we increase options within Douglas County, Wisconsin. We know that that is an area that has significant needs as well, but do not have a lot of options to be able to care for people within that community. We've also talked a great deal about Phase 3, which is really engaging families in care. We look at Amber Wing as one of our projects. We do a wonderful job of working with the kids, and we have some options for families as part of that care. But what we recognize is that children come as a family unit, and we need to be able to provide resources, support, and skills for parents and families as well as part of a comprehensive behavioral health program for kids and teens. Miller-Dwan Foundation has had a really strong history of meeting community healthcare needs and sometimes meeting them in a way that is different and sometimes unheard of, really.
We really have learned to say as a staff, why not?
We have been so lucky as an organization. People in this community have really stepped forward and supported our ideas to have significant positive change in healthcare. It really is amazing.